Welcome back to Fox 43 AM Live. We're here now at the Holton Community Hospital with Elizabeth Gerhardt, the Director of Nursing. Good morning. Thank you for welcoming us into the hospital.
Of course. Good morning.
And I want to talk about, you recently had a trip to Capitol Hill, and I think you could probably do a little bit better myself and describe what you were doing there, what you were advocating for the people here in the community.
Yeah, absolutely. So I went to Washington, D.C. this week with the Kansas Emergency Nurses Association. So that's a group of emergency nurses here in Kansas. It's a volunteer nonprofit group. We get together, and the mission is to advocate for safe nursing practice and just elevate emergency nursing practice, specifically in the state of Kansas. So the ENA is a national organization, or actually an international organization, and we have a Kansas chapter. And so every year the ENA on the national level has a fly-in event, what's called Day on the Hill. And so this will be my third time, this was my third time flying into DC. And so this group, ENA, actually focuses on specific pieces of legislation. And so the emergency nurses that fly in from all over the country, we set meetings with our individual legislators, and then we focus on the same 3 pieces of legislation in all of the meetings that are taking place with the different states.
So this year, what were the specific items that you guys were advocating for?
The 3 specific pieces of legislation for this year focused on funding for the EMSC program, that's Emergency Medical Services for Children. That's a grant program that's been around for many years and helps fund some of the services and training that we use for pediatric patients in the emergency setting. The other 2 bills focused on workplace violence, one of them on the prevention side and one of them on the how we deal with violence after it happens. So essentially the SAVE Act would make assaulting a healthcare worker a federal crime.
Wow. Okay. Some very important topics there. And what was the feedback like from the representatives?
Very, very supportive. EMSC is a program that's been around for a long time, and so the legislators that we met with this year had not signed on to co-sponsor that bill yet, but we're hoping that they will. And then the other one, the SAVE Act, actually when KHA was there the day before, they had also mentioned the SAVE Act, and so both of the legislators that I met with were very supportive, and 2 of our legislators from Kansas had actually already signed on as co-sponsors for the SAVE Act, so that was really exciting. Very supportive. So
now, bringing it back home a little bit, as the Director of Nursing, kind of overseeing various departments, I know what acute, ER, inpatient, swing bed, how do you balance kind of clinical responsibilities and administrative duties?
Honestly, it's tough. I think that's probably true for anybody in a nursing leadership role, that we want to make sure that we stay clinically relevant and we understand what's happening at the patient care level on the front lines. But there's also a whole host of duties that have to be done to make sure that the bills get paid and the lights stay on and that we pass all the regulatory checks. So that's definitely a challenge. I would say that some weeks are better than others. This week I traveled, and so I haven't been here quite as much clinically as I want to be, but it just so happened today that I happen to have my schedule line up perfectly, so you might not be able to see this on the cameras, but I've got a blazer on top and my scrub bottoms on the bottom because I was just in the department doing patient care 20 minutes ago. So some days it's balanced well, and some weeks it's just really a struggle.
Looking at staffing, I want to expand upon that a little bit. What strategies have you implemented to attract and retain skilled nursing staff here at HCH?
I'll say that at Holton Community Hospital, we try to be as creative as possible. So of course we try the best we can to offer competitive pay and benefits. We offer tuition assistance. We're always on the lookout to make sure that any scholarship opportunities that are out there for our nursing students, that are in that pipeline, that I'm always looking for any scholarship opportunities or funding opportunities to help them get their professional development or help them get their school paid for. We try to work really hard with our staff to make sure that we've got creative staffing options, and so that we listen as well. If they let us know that we've got more high acuity patients and we could use 1 extra nurse or we could use an extra CNA, we've got the flexibility to be able to put out a kind of a call for staffing and say, hey, who's available? It's just a busy day in the ER or a busy day, on the med-surg side, and be able to get some extra hands here. So that's nice that we've got that flexibility.
Wonderful. Well, Elizabeth, one final question, just any final thoughts for our viewers out there about kind of the nursing staff here at Holton Community Hospital?
I've been a nurse for a long time, and one of the things that I always say when I'm coaching younger nurses or new nurses, student nurses in particular, on where they might consider working. If you can work in critical access, you can work anywhere because we wear so many hats, and we we learn an additional set of skills working in critical access. You know, we are respiratory therapy, we are IV therapy, we are the infusion nurse, we're the med-surg nurse, we're the ER nurse, and many of our nurses even cross-train beyond that to different departments within the facility here. But I would say for nurses out there looking at where they could work or what their options are, if you can work in critical access, you can work anywhere. It's definitely a great skill set to have.
You're good to go. Yeah, like you said earlier, flexible. It's all about being flexible.
Absolutely.
Fantastic. Well, Elizabeth, thank you so much for welcoming us into the hospital again.
Of course.
It's been a pleasure chatting with you. Of course, everybody, if you want to learn more about Holton Community Hospital, head on over to holtonhospital.com.